Hi, it's Patrik Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered. And in last week's episode, I answered another question from one of my clients. And the question in last week's episode was, Dad developed a pneumonia and now needs to be ventilated again. What should we do to make sure he keeps improving? You can check out last week's episode by clicking on the link below this video. In this week's episode of Your Questions Answered, I want to continue answering the next questions regarding James and Christine's dad in ICU who's had a hemorrhagic stroke. James and Christine's dad had a brain decompression where they evacuated a large bleed from his brain after the hemorrhagic stroke. And their dad also underwent a craniectomy, which is a partial removal of the skull to decrease the brain pressures after the bleed. James and his sister Christine were getting their dad in one of the best hospitals in the United States, the Cleveland Clinic in Ohio. In the meantime, their dad was getting a tracheostomy because he couldn't be weaned off the ventilator and the breathing tube. He also had a PEG tube for feeding inserted as well. He also had ongoing seizures due to the stroke, and his anti-seizure medications needed to be optimized so he could quote-unquote wake up and progress to neurology rehabilitation. In today's one-on-one consulting and advocacy sessions with James and his sister Christine, we look at some setbacks their dad is currently going through. He had to be put back on the ventilator due to a pneumonia, and he also ended up with a central line or CVC line and arterial line again. So in today's episode of Your Questions Answered, I answer a series of questions from James and Christine again that are excerpts from various one-on-one phone and email consulting and advocacy sessions with me. And the topic this week is, Dad is still ventilated with tracheostomy after 5 weeks in ICU. Now he's confused and agitated. What should we do? You can also read or watch previous episodes of this series of one-on-one consulting and advocacy sessions with James and his sister Christine if you're clicking on the links below this video. And if you are watching this on YouTube, please click on the link below this video. That'll get you to our website where you can access this episode as well as all the previous episodes and a lot of other free resources. So James writes, Thanks, Patrik, for your last email. It makes perfect sense. And thank you for your help. You offer an invaluable service. It is really appreciated. I wanted to give you a quick update. My father was on the tracheostomy collar all last night as well as today. They are doing something called inflation, where they are putting him back on the ventilator every 4 hours, just for half an hour. I believe they're going to stop doing this to see if he can breathe on his own indefinitely with the tracheostomy collar. It sounds as though they are trying to get him to step down early next week. Please let me know your thoughts on all of this. In addition, my father is still very angry and irate. He is so strong it is hard to restrain him at times. He is also trying to push himself out of bed. I believe he cannot get very far because he's weak on his right side. They did take the central line out of his neck, and we visited with the infectious disease doctor that is going to put him on a more mild antibiotic. What's your suggestions for the delirium? I was thinking a short-acting tranquilizer may calm him down, but I don't believe his seizure doctor wanted to add any medications at this time. However, I don't believe the seizure doctor understands how irate he is. In addition, he's mumbling and talking non-stop. He's very responsive to commands today and responds instantaneously with ease. He can lift his leg and raise his arm, but can't seem to open his mouth or stick out his tongue on command. Why do you think that is? We are getting little words out of him like yes and no and so forth. Please give us your thoughts on all of the above, but it appears as though we are on our way to step down. We are also looking for guidance on where to go after step down and how long you believe they may keep him in step down. I don't believe he can go to rehab until he can do 3 hours of rehab a day. Thank you, from James. So here's my response. Hi James, thank you for the update. I'm very pleased to hear about the progress in relation to staying off the ventilator, knowing that your dad can breathe on the tracheostomy collar almost 24 hours a day. Inflation with the ventilator every few hours for about 30 minutes will help him as well, as he will get additional inflation for his lungs. Once your dad can be off the ventilator continuously, he will be ready to go to step down and they can manage the tracheostomy. I think if he can prove to stay off the ventilator over the weekend, he will be truly ready to go to step down and he won't need ICU anymore. Do you know how often they suction him via the tracheostomy? Do you know if he has lots of secretions, and do you know if he has a strong cough? The answers to those questions will determine if he's a candidate to have the tracheostomy removed at some point as well. He also will need to be able to swallow. I'm not surprised your dad is angry and irritated after 5+ weeks in ICU with a stroke. It comes with the territory, but it's good to know he's more awake, he's trying to talk, and he's also trying to get out of bed. Those are all good signs, and the next challenge will be to channel those efforts in the right direction if possible at all. That's where I believe neuro rehab will have its place. I don't think restraining him is the right approach, as it will make him more frustrated, but I also know from experience that sometimes that's the only option. The delirium or ICU psychosis probably needs to be managed with medications such as Seroquel or quetiapine for anxiety, potentially some diazepam or Ativan, maybe some small doses of haloperidol. But I am advocating for small doses of tranquilizers or antipsychotic drugs rather than big doses, because you only want him calm and not asleep during the day. However, he needs to sleep at night. But I would also strongly advocate to get him back to normality as much as they can. For example, get him some fresh air, natural daylight, a shower, etc., just as we discussed in one of our phone calls this week. Patients who have been in ICU for many weeks are often confused, agitated, and aggressive because of the side effects of the drugs they have during the induced coma, and they have a disturbed day and night rhythm because of the lights on in ICU 24/7, noise, and people working 24/7, etc. Therefore, getting out of ICU is a good thing, and I believe it's timely now. On top of the confusion that many patients experience in ICU after long-term stays, your dad has to deal with the effects of a stroke, which will increase his level of confusion. On that level, he has many challenges to deal with, and it's advantageous going forward if he won't be ventilated, so the focus can be more on neurology rehab. If he can go on to neurorehabilitation, they will also be reviewing his seizure medications. For now, they are probably erring on the side of caution still to keep him seizure-free, hence the high doses of Keppra. It's good to hear he's trying to mumble words and moving his limbs, sticking out his tongue, etc. I think that's encouraging given where he was at a few weeks back. A neurology recovery after such a significant event like a stroke, including many weeks in ICU, is difficult to predict because the brain is the only organ in the body that can't be controlled. Every other organ like the heart, liver, lungs, kidneys can be at least temporarily controlled, but not the brain. Therefore, from everything you are describing, He's making progress and his efforts need to be channeled in the right directions with a neuro rehab team. As far as step down goes, I don't know how long they'll keep him there, potentially a few more days, also depending on whether they can remove the tracheostomy or not. Some hospital wards don't have the skills or expertise to look after tracheostomies. You probably will need to find out. I hope that helps for now. Please let me know if you want to get on the phone or if you have any other questions. Many thanks from Patrik. And if you have watched thus far and you want one-on-one consulting and advocacy, please click on the links on the top of the website and you can select from the options that work best for you. So here is James' response. Thank you, Patrik, for your email. I agree and thank you for the good advice. We also want to know what we should expect from a neuro rehab team. I'm a bit concerned that they will not be able to manage him as well. He still needs to get suctioned every hour or so. His cough is strong and I do believe he can swallow, but they have not done the barium swallow test yet with the dye. He could get pneumonia or seizure at rehab, and then what? Please advise. Here's my response. Hi James. Yes, your concerns are valid with neuro rehab having difficulties managing him. Moving forward, however, from what you are describing, your dad has come a long way even within a week. Last weekend he was just on the verge of weaning off the ventilator. Now it looks like he's managing the transition to be breathing by himself fine within less than a week. That's very encouraging. He also got progressively more and more awake and stronger, and that's on a large dose of Keppra, and so far he's been seizure-free. Neurology rehab should be focusing on strengthening his movements as well as strengthening his right side, which is weak from what I understand. Mobilization and walking as well. Furthermore, they should also be focusing on speech recovery and talking abilities. He's probably not quite there yet to go on to rehab, but I believe he's clearly taking steps in the right direction. Let him go to step down and let's give him more time there. At this stage, you can only take one day at the time, but given he's come such a long way even within the last week from what you are describing, he's definitely making progress. It would be advantageous if they can remove the tracheostomy as well, but again, he's not there yet. There will be less ICU input going forward and hopefully more input from neurology, and they should be the experts in driving his recovery forward. Any questions, please give me a call or shoot me another email. Here's James' response. Hi Patrik. When will he be clinically considered to be weaned off the ventilator by definition of the hospital and also for insurance purposes? I.e., can he go to rehab on the tracheostomy collar? Or does he need to be completely off the tracheostomy collar and the hose? Please explain. Many thanks from James. Here's my response. Hi James. He'll probably be considered breathing by himself after about 3 to 4 days without the ventilator. He should be able to go to rehab with a tracheostomy and the collar. Many neurology patients have a tracheostomy, therefore, the chances that a neurology rehabilitation can manage a tracheostomy and the collar are pretty high, although you better start asking them now to find out for sure. So, how can you become the best advocate for your critically ill loved one? How can you make informed decisions, get peace of mind, control, power, and influence quickly whilst your loved one is critically ill in intensive care? You will get to that all-important feeling of making informed decisions, get peace of mind, control, power, and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you will learn quickly how to make informed decisions, get peace of mind, real power and real control, and how you can influence decision-making fast whilst your loved one is critically ill in intensive care. Your free instant impact report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free instant impact report now by entering your email below. In your free instant impact report, you will learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions. Discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle, and vulnerability even if your loved one is dying. You will get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power, and influence in your situation. You will get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You will get crucial behind-the-scenes insight so that you know and understand what is really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again next week in another update. Make sure you also have a look at our blog section for more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. Also, have a look at our membership site intensivecaresupport.org for families of critically ill patients in intensive care. You can also call me, find international phone numbers on the top of the website. Also, you can look at our ebook section, and you can also get one-on-one consulting and advocacy with me via Skype, over the phone, or via email by clicking on the consulting tabs on the top of the website. This is Patrik Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.